Hi, this is Naomi from About Face Skincare in Philadelphia, and I just wanted to chat a little about the new Thermage FLX. For those of you that aren't familiar with that, what Thermage is a company that created a fabulous radiofrequency-based device that does non-invasive skin tightening, so that for those of us who are looking at our faces going, uh-oh, what's happening here? The radiofrequency energy application onto tissue causes skin contraction and tightening. It's really kind of an amazing thing to watch happen. There's long history with radiofrequency energy being used in tissue tightening in a variety of different medical applications, so that we know that radiofrequency really does work. The first thing that radiofrequency does when it hits tissue, and what happens with it, is it converts to heat when it hits tissue. And when it hits that tissue, the collagen in the tissue gets all kind of crunched up and disorganized. And that's an important thing, because your skin's going to try really hard to recover from that by healing it and kind of putting your collagen back in its regular condition. But when it figures out that that's not possible, it starts to grow you new collagen. So Thermage, the radiofrequency component of this, is really about the only thing that we know of that's going to recreate collagen. And collagen is like the metal grid in a mattress, a bed mattress. It holds everything together. It keeps the skin where it's supposed to be, and it allows the skin to move around but still come back to its regular condition and regular position. It's been really transformational in terms of the aesthetic world and being able to get some skin tightening without going the surgical route. The Thermage FLX is now the 4th generation of this particular device. It's become much more sophisticated. Some of the things about the FLX, as opposed to its previous iterations, is that it has a slightly larger spot size that we can treat with. So this is an application that's done in a stamping fashion. So we take our handpiece and we put it down against the skin. We let out one pulse of the radiofrequency energy. We pick up our handpiece, we move it to the next spot, and we do that all over again, all over the face. We can do it up to 1,200 times during the course of one treatment. And the net result of all of that is visible right at the time of the treatment. But with FLX, because the tip is a little bit larger, it makes for a quicker treatment. The device itself offers some other features that make it more comfortable to have it done, although radiofrequency in general has a reputation for not being the most comfortable treatment. This format of providing radiofrequency energy to tissue actually is surprisingly comfortable. We don't need to use any of the gases that sometimes we use, Pronox, that sort of thing, to help to manage pain. It's just not necessary. They've taken care of that in a couple of different ways. One of the ways is that there's a vibrating component to this, that in some areas, because Thermage can treat not just your face, it can treat any body part that you want to treat. So it can do thighs, it can do upper arms, it can do knees, it can do any body part. The vibration component of this kind of distracts your mind from what the Thermage is actually doing, and it makes the brain think there's nothing much going on. So it's a really nice built-in diversionary tactic that they've included, along with the cooling component of the tip. So there's actually cryogen gas that comes down through the tip to cool it, so that what you're feeling, even though radiofrequency converts to heat when it hits tissue, what you're really feeling is cold. And the cold is comfortable. The vibration really does what it's supposed to do. The treatment is pretty fast, and it's a much, much easier, more pleasant treatment than it has been previously. We do it all the time. Nobody has a hard time getting through it at all. To the contrary, when we show them at the end of the treatment what the improvements are, right then and there, they can't believe it and they're ready to do it again. When can I get myself on the schedule for my next one? And that's something that we talk about with our patients. This collagen building anti-aging approach is very important to stay on top of. As we age, we lose collagen over time, and this starts out building more collagen so that by the time you get to, say, my point in life, I ought not to have very much collagen at all in my facial skin in particular. But because I've been doing Thermage now for, I guess, 19 years, there's still plenty of collagen to work with. So it really is anti-aging in the sense that structurally, because collagen is the thing that holds your skin together and in position, structurally, you are every year, every 6 months, however frequently you decide to do the treatment, you are constantly renewing your collagen and making yourself really anatomically younger. Most people do this once a year. I know that there are people out in Hollywood, there have been all kinds of articles and discussions about them, and they'll do it every 6 months. But again, most commonly it's done once a year for myself because I have access to it whenever I want. Anytime I feel like I'm sagging, I do it. I don't really keep track of how frequent that is, but I want to be able to keep getting results from it, and therefore I'm going to just keep at it. And I encourage everybody to do it as well. It makes an enormous difference in how we perceive age. Skin starts to pull down by gravity, or as a result of the gravitational pull, and it slides down our cheeks. And very often when you look at people who are, middle-aged plus, what you'll see is that they have, instead of a nice, sleek jawline, they end up with more of a square jawline. And it's one of the things that our brains recognize immediately as being a sign of aging. And since there aren't a lot of people I know who are like, hey, yeah, bring on the aging appearance, it's a really easy way to try and fight that and keep that appearance at bay. And the sooner you start doing it, the more collagen you have to work with, and the more effective and efficient the treatments actually are. This was one of the first devices that I purchased when I got into the world of aesthetics almost 20 years ago. I took a lot of training and really wanted to understand the nitty-gritty of it. Prior to being in aesthetics, I had worked in orthopedics, and radiofrequency was used in orthopedics, believe it or not, also for tissue tightening in a different way, because it was used for tightening ligaments and tendons that had been stretched and injured. And so I knew quite a bit about how radiofrequency worked with tissue before I ever got into aesthetics, but that wasn't going to be good enough for me. So I learned everything else I could learn about it. I talked to some surgeons about what did it really do, how did it really work, and started doing the treatments. And in those days, it was very rudimentary how we were doing the treatments. There weren't nearly as many available pulses to do the tissue tightening, so we actually had to use slightly higher temperatures, which were much, much less comfortable than they are now. Because you had to kind of get it all done quickly with only a few pulses. We used a grid. It's an actual tattoo transfer that gave you the directions, kind of like a paint by numbers kind of concept of where to place each one of the various pulses across the face. I've been doing this for so long, and I've done so darn many of them that I don't have any need to use the grid. And the devices haven't changed in terms of the actual energy that's utilized, but they've changed in terms of the delivery system. And I've gone through now 3 of them, 3 of the 4. The one of them, there didn't seem to be enough change to warrant getting a new device. But it's an easier treatment, easier both for me and for you guys. I don't know how many of these things I've done. I could probably go back and do an average, but it's probably got to be up over thousands. And at this point, I have been asked to be a trainer for Thermage. I don't do that anymore, but I did that for quite a while. And the experience of doing this treatment and watching as the result develops excuse me, over time, is a really important facet in how to become a really good provider. This is not a treatment that you just kind of, oh, look, here's the person's skin type, here's their age, and here's the setting I use, and let me go pulse along. That is not what you do. Thermage is not just overall tissue tightening. It also has a component where you can use it actually for sculpting. So if we want to make cheekbones, for instance, more pronounced, there's a way to place those pulses so that you're contouring the skin more than just tightening it everywhere. You're actually sculpting it. And that's a really, really cool thing to do. Not only can we sculpt the face, but one of the reasons that I don't have like a big hanging turkey neck at my age is because I put pulses down here all the time. This is a really, really tough area to tighten up without a lift, without a lower facelift or a neck lift. And I don't want to go under the knife until I absolutely must. So I do lots of pulses down there, and it has made an enormous, enormous difference. Difference I can tell when I see other people who I know are my age. And it's just a really fascinating tool to use to do contouring of the body. You know, more pulses here creates more tightening, which means that the adjacent areas appear to be more full. So you use that or we can use that to our artistic advantage in creating these, not changes to your face that are going to make you look different than you should, but they're going to be changes that make you look more like you used to. And that's what people want. People aren't looking to become somebody else. They want to just look the way they did 10 years ago, 5 years ago, whatever. And this is a really good tool to be able to do that with. It's important to have appropriate expectations, and so I want to set them for you right now. When you get the treatment, when you sit up from the treatment, you are going to see a difference in your skin, and you're going to feel a difference in your skin. It's going to feel tighter, it's going to look tighter, and you're going to be shocked and amazed and hopefully super happy. That tightening is actually not the result that we're even really looking for. That is a more temporary kind of a result. What we're really looking for is the longer term result. So your body's going to look at what has been done to it for, I don't know, 4 weeks, 6 weeks, something like that. And it's going to continually try to heal the collagen that we just jumbled all up. And it's only after your body figures out that it's unable to do that, that it starts to grow more collagen. And that period of time lasts for somewhere around 4 to 5 months. So your full result from the treatment is visible at about 6 months out. But right away, you'll see that tightening. Your skin may have a little tiny pink coloration to it. That'll be gone half an hour to an hour after you walk out of the office. Typically, people do not have swelling. They don't have irritation. They don't have anything. Nobody knows that they've done a darn thing, except they look better. So you might get questions like, oh, did you just get back from vacation? Or, wow, you must have had a great night's sleep last night. You look terrific today. Those are the kinds of comments. You're not going to have the kind of comment like, all right, now, what did you do? Because I can tell, were you the plastic surgeon? You're not going to have that kind of a reaction to you. But over that 6-month period after the treatment, the results are going to be more and more pronounced. They're going to be subtle, but there. And people are going to notice. And so you're going to have to come up with a story of whether you want to tell the truth that you had Thermage done, or whether you're just on some kind of a great lifestyle thing, and this is all the result of that. It's your call which way you want to go. But you can walk out of this office and nobody will know that you've done a darn thing, no downtime, no nothing, easiest thing in the world. If you're looking for an anti-aging, non-invasive, collagen building, beautiful result treatment, I think Thermage is probably going to be your best bet. And it doesn't matter what color your skin is. It doesn't matter what your facial structure is. It's going to be effective for you.